Hello everyone, I'm Norma Ramos. I'm the Senior Associate Director here at the Institute for Policy and Civic Engagement. I'm super excited to welcome you all to our first one-shot for 2026, right? I think, so here we are in February, and just wanted to give you a couple of updates and introductions before we kick it up and pass it over to Dr. Albrecht to share the civic engagement lunchbox. But I also wanted to share in terms of our Civic Engagement Research Awards, a little bit of background is the Civic Engagement Research Awards is an opportunity for ISSE to support UIC faculty that centers on the concepts and practices and methods of civic engagement. And so we're super excited to support those research awards annually and have our awardees come and share their research. The following year after should do their research. A couple of housekeeping items as well before we kick off is we will have the presentation, we will engage in a Q&A for a little bit, and then we're going to record today's session, but only just the informational session, not the Q&A. Restrooms are actually just all the way down the hall to my left, right? Area, but all the way down the hall. There is food here for you all to enjoy for the lunch hour. And so please welcome and help yourselves sign into our sign-in sheet here as well. And then I'm excited to just kick it off and share that civic resilience by design, community voice, network infrastructure, health and wellness policy, Chicago, and welcome Dr. Kate Buffer. Thank you. Thank you.
So I appreciate everyone coming out to see this presentation. I'm an assistant professor in the Department of Public Policy Management and Analytics that's within the College of Urban Planning and Public Affairs. And I just want to say again, a huge thank you to IPSE and all of the support for making this research possible. Not only from the monetary side to be able to engage with research assistants, but also engaging with organizations that IPSE has a fantastic reputation with and is known. And so that was a huge benefit to be able to conduct this research. So what we're going to focus on today is collaborative efforts. The collaborative efforts I'm going to discuss are focusing on health and wellness. But our big question is how can collaborative efforts not just survive, but thrive and adapt under pressure? I'm sure under pressure is a very clear, comes up in your mind, thinking about policy change, funding change, and we're going to dig into all of that. So I'm going to walk through in the research that I conducted 4 pillars of resilience that were identified through qualitative and quantitative research. But I want to just center us on what these 4 things are going to be, and to make it clear from the beginning that these 4 pillars rest on and are interdependent with civic and community engagement. So as I go through this, that is a given, if you will, but it's not something that's easy to attain. So we're going to talk about how networks actually do that. So I'm talking about networks here, and I'm going to just make clear what the scale is. Through our research process, we identified 54 multi-organizational groups, and I'm going to refer to those as networks. And those networks that we identified are specifically focused on health and wellness. Now, they do have sub-policy areas that I'm going to get to, but we talked to the managers and leaders of all these networks to help identify their peers. We identified 54 networks, 988, almost 1,000 unique organizations in Chicago and Cook County that belong to these networks. So that's kind of thinking about the scale. And the connections or ties was over 1,500. So the actual ways these organizations are all connected. One of the methodologies that I work with is social network analysis and the visualizations of networks. So I want to share this with you as just a way to get us grounded, but then actually dig deeper into what this picture means. So the larger circles here are those purpose-oriented networks, or the networks that exist here in Chicago and Cook County. You may be familiar with some of these. One of those circles represents Westside United. So Westside United is a well-known network. That's usually one people recognize right off the bat. But there are 53 others that also are in Chicago and Cook County that focus on health and wellness. So what does this big picture mean? you see that in the area of Chicago and Cook County, all those lines mean that there's a lot of interconnections between these networks. And I just want to give us this understanding because that's going to be part of our resilience discussion and how community actually is brought into these networks. So one of the other things that we see here is this big group in the middle, right, that has lots of connections, and other networks around sort of the periphery. Normatively, that's not good or bad. The idea here, though, is that we need to understand that these networks who are struggling under the pressure of funding changes, community need changes, all types of different things, are very interconnected. They need each other, but they also sometimes compete with each other. So what do these networks do? These networks engage in a variety of activities, and we identified a few groupings to really help us anchor what these networks do. More than half of them engage in need assessment, so they go out into the community to understand health and wellness challenges in the community. And also a large portion of them engage in protocols for coordination, so they actually talk to organizations and other networks to get everyone communicating. But as you can see here, the top three, needs assessment, protocols for coordination, and then managing their own programs and services, that takes a lot of resources. And so one of the key elements of resilience that we're going to talk about is resources, but it's not the whole picture. I also want to talk about how these networks look at different sub-policy areas. So I use health and wellness as sort of the way that this group was defined, but within that, there is a proportion that look at specific health conditions, like the Chicago Asthma Consortium. There's also a group that focus specifically on mental and behavioral health, and others that think about health from the perspective of community and economic development. So I bring this up to highlight that while the networks I'm going to be talking about are all trying to survive and adapt, they do have different policy areas or policy avenues that they use to think about health and wellness. And because of that, different ways they engage with the community as well. So who participates or what sectors are a part of this? This big line at the top, 66% of the organizations in these networks are nonprofits. Nonprofit organizations have a draw and connection often to community, but they have the same challenges with resources. So I just want to make it clear that these networks have a majority of nonprofit organizational members. And when we look here at government organizations where it's 8%, that's not to say that government isn't engaged, but in the area, only a small number of the main governmental departments or agencies are actually engaging in these health and wellness networks. And in general, most of these networks have about 20 organizations. So I'm trying to give you some background about what they're working with to then understand how they can be resilient. We also know from our quantitative work that the nonprofits who are engaged are really tightly connected, meaning that those, especially CBOs, so the community-based organizations, are the ones who are serving roles where they're sharing information, doing lots of handoffs, and important engagement between networks. A network and its connections struggles both sometimes for resources, and if those organizations in those connections are struggling, it can really affect how the network can engage in its work. So that's the background of what the research is about. And today I'm going to focus on the qualitative work that we have done and understanding how resilience is defined and also the mechanisms through which these networks think about resilience from a civic and community engagement perspective. So from the biological sciences, often resilience is thought about as a biological system that bounces back. Social science is definitely pushing on that idea, and one of the main things I want to engage with today is thinking differently about resilience as simply we've returned to our state before, but rather it's the capacity for adaptation, recovery, and then maintenance. And networks can learn to do this. There are ways that we identified that these networks can learn to come back from or respond to these challenges. But what does it take? What does a network need to do to learn, and to adapt. And a very clear finding of this research is that strengthening and centering engagement in the civic and community space underpins the definitions that these networks think about for resilience. So it brings us back to these 4 pillars. I'm going to talk about capacity, adaptive governance, and strategic planning, as well as resource sufficiency, as the 4 main parts of resilience for these networks. Each one of these sort of pillars isn't really a pillar. So if anyone has a brilliant idea of another word, these are actually strands, if you will, that are woven for resilience. It's a little tricky to get that into a really nice visual, but we're still trying. But the idea here is that these 4 legs of a table of resilience, if you lose one of them, that's a wobbly table, right? So there's going to be some further research that we're doing to understand how to bring together these pillars or couple them, and the direct ways that affects network effectiveness and its connection to its mission and other types of sort of outcome measures. So that's the next step. Let me talk about capacity. We interviewed 40 of the 54 managers for the networks across the Chicago and Cook County area, which we're really proud of reaching a pretty decent response rate when you think about it from a qualitative interview perspective. And capacity isn't just an insular concept. There's capacity to do things that networks need to have. But then what's more important, really, is the idea of capacity with, capacity together, and capacity across. By and large, the network managers discussed their capacity to do what the community needs, but also engage with their funders or deliver services as multifaceted. And one of the main things that came across was that resilience really emerges when the capacity together, the capacity with, and the capacity across is highlighted and those capacities are brought together. So one of the main ways to think about this is that capacity is related to community-centered staffing of these networks. So one network manager talks about how their teams and their communities look completely different because they are structured around the community context, not some predetermined model. So in the health and wellness space, there are many predetermined models that come from funders or government sort of perspectives. But a lot of the networks that we spoke with is that those predetermined models don't work out of the box, right? They have to think about the community context specifically. Collective sense making was also key. So what has been such an incredible part of this project is that collective sense making was one of the main ways that capacity is built. What does that actually mean, right? That means the community is speaking to and engaging directly with these network managers and leaders. And so the solutions are things that are being co-created. And one of the main things here is that a lot of community sense-making just takes all those assumptions and tosses them aside and helps the network better understand how its capacity directly relates to what the community needs. Capacity also, this idea of capacity across, is about the web. So that whole network map that I showed has all of these lines. Because Chicago is the 3rd largest city in the country, there are so many organizations and entities. For the community to act as the primary vehicle, a communicator across all these different webs, I think that's what's a special point of the particular project of that network. So the networks are not necessarily looking for connectors to be big organizations. They're rather looking at those CEOs and community members themselves to help build the connections that support and also share information and resources. One of the other aspects is governance models. So in much of the work that I do, I also study government engagement with nonprofits specifically, and sort of the governance, right? How we do things is essential to resilience for these networks. The networks might be centralized. They also have a participatory structure sometimes, or there's a hybrid. where it brings together aspects of both this more structured, centralized, or the participatory together. But what I want to highlight here is the balance. Resilient networks are able to balance that structure with flexibility and have a clear accountability space in the network. So I think this is one of the best ways to sort of think about it is when networks are started, community can be centered in the steering committees, how they determine budgets, even hiring decisions. So bringing in very specific types of experiences and very specific perspectives into the network. So they're often in this data, resilient networks are often grassroots movements, actually. And I love the way the network manager reiterated this. It's about those who set the table. And the setting of that table for the work is going to be key to resilience in the future. One of the other important aspects that we really found throughout our interviews is the idea of a true advisory board. So often in networks that work with community challenges, not just health, but in lots of different policy spaces, there is a community advisory board. But this network manager said, well, we asked community members to be in an advisory role, and they said, no. We don't want to just advise. We want to be on a committee that has decision-making power. And so a key element of this is genuine authority with community, not token consultation. I feel like we can understand that as something that's really important, but often that's not the way that networks are established. It's not the way those tables are set, but it's a clear need to support the resilience of the network.
Good.
We also talked about strategic planning. Strategic planning as a process that a network would undertake sets its goals, sets the way it envisions its future. But one of the biggest challenges for networks, if that strategic plan isn't truly rooted in legitimacy, presence in the community, and advocating for what community needs, is those strategic plans sit on a shelf. So what really mattered was a network embedding itself in the already existing groups and connections of the neighborhoods, and really thinking about their presence being something that is symbiotic, right? That the network is influenced by the community, helps them understand their role, and the network itself can help the community develop. And so really opening up strategic planning as something that deeply connects with legitimacy, presence, and advocacy. So we started with this idea of pressure. That resilience is the ability to adapt and maintain under pressure. These local networks feel pressure around resources more than any other part, which I think we can academically and intrinsically understand, that pressure for resources. Most of these networks depend on, and so this is data from fall of 2025, most of these networks depend on federal grants in combination with local or state foundations, sometimes national foundations, and then some public donations or contracts or engagements with city and county. I think this quote actually says it best, so I'm going to read it. This is from a network director when we asked about the resources and the future of the network. So they said the big ugly bill did remove us. And so what this network director meant is that our actual job. We have lost our funding nationwide. Our program will no longer exist after September 30th. And everybody nationwide is being laid off. In this sort of environment, what are networks to do, right? What are these essential groups of organizations who directly affect people's lives supposed to do? And so one of the main things we asked them about was what they're trying to do, how they're adapting, and where they're going. It was really clear. Competition won't work. One of the big takeaways from what I'm sharing today is that understanding how many other networks are in this space actually helps them know who to work with, not who to compete with. And so a big takeaway of what I'm sharing is This is about networks thinking about their future and building goodwill and intentionally trying to get resources to other networks. So a key element of resilience, even in the absence or in the pressure of these resources, is rising tides lift all ships, right? We have to work in a way that gets resources to those networks that we can collaborate with rather than compete with. And they brought another very important thing to the table that was a key element of thinking about resources. The communities already know. They've known. They've been telling them what they need, and the communities already know some of the solutions if there was just space for them to offer them. And so a key takeaway of this research is that change is not necessarily going to break a network, but it's how that change is engaged and the way in which the community is brought into that process. I really wish I could say that all 54 of the networks I initially identified still exist. They do not. There are 51 of them currently. The 3 who are no longer in a network form lost their key funding or their key staffing elements. But those individuals who I have talked to about the changes really pointed out that simply because the name of that network or that structure lost its resources, the community has thought of other ways to use some of the capacity that was there, maybe not as formally, but they have transitioned it into other things. And so that's a key element of research that's ongoing. So if I can leave you, I'm going to leave you with a takeaway and then a question. Network resilience is going to fundamentally be related to the mechanisms of network resilience that we can study and understand, is related directly to the ways in which community voice is brought into networks. And really, community voice is a resilience generating feature. Throughout all of the threads, if you will, or the pillars of resilience, that was a clear message. And it was a message that was centered around both formal and informal ways community is engaged. For our conversation today, what I wanted to do, offer the research and also open it up to this question. From where you sit, and I mean that, from where you sit in your life experience, your job, your role perhaps in research or in a university setting, what systems do we need to really think about to support or build? Because there's a lot that already exists. Sometimes it's just identifying and connecting, or sometimes it's pointing out that a solution is actually working and it needs to have a different level of support. So I wanted to leave us with this question and then open it up to you all to think about that and talk about it, and also any other questions you might have about my research. And if you're curious, the team that I worked with, which was a fantastic team of undergrad, master's, and doctoral research assistants supported by the generous support of IPSI, put together a community report that we've shared with network managers. The handy QR code will take you to the link to where that report is. And you're welcome also to reach out to me at any time if you have any questions. Thank you.